Hello, this is Dr. Vikas from India. Today I have a very unique case to show. This gentleman, he is a 60-year-old male. So he came to me with the complaints of left-sided nasal obstruction since 6 months. So his nose was not able to open even. He tried using Utravin nasal drops and some decongestant tablets, but it was not opening up. So he came to me and once I did the nasal endoscopy, I could see a mass which was pinkish and it was completely occupying the left nasal cavity. So it was present mostly, you can see in the medial aspect of the middle turbinate. It is touching the middle turbinate, filling the inferior part of nasal cavity and going till the nasopharynx. So I decided to do a CT scan for this patient. CT scan showed the soft tissue mass exactly in the location which I described, and there was no bony erosion or any contrast uptake. But you can see this was not a picture of a typical nasal polyp, because nasal polyp is mostly they are pale and polypoidal. The look, it seems more like a soft tissue tumor. So, given the benefit of doubt, I took the patient for general anesthesia and for excision of this mass. So, what you can see right now, I am using the backbiting forceps to do the uncinectomy on the left side. So, uncinectomy has been done. You can see some amount of bleeding also. So, this I am out fracturing the vertical part of the uncinate, so that I can take it out safely. You can also see some bubbles, which does show that we are at the verge of entering the left maxillary sinus. So you can see this is removal of the vertical part of the uncinate process. So basically, while doing uncinectomy, you do the uncinectomy at the shoulder of the uncinate process, which is a basically a boomerang shaped bone. It forms the hiatus semillunaris, which is opening inside the maxillary sinus through infundibulum. So you see, I have removed the vertical portion. So there was not needed to remove the complete upper part of the or vertical portion of the uncinate process. I just wanted to see the attachments or any extension inside the maxillary sinus. So at this point, you can see the mass is slightly going towards the maxillary sinus, which is I am debriding right now. So my first step would be to enter the maxillary sinus. This is what I have done is removal of the middle turbinate. I removed a portion of the middle turbinate just to have an access so that I can see the attachment of the mass clearly, and without damaging the normal structures I can take it out completely, leaving no chance for any recurrence. So you see I have removed the vertical part of the middle turbinate, and now you can see the mass is going toward the posterior fontanelle, towards the region of the attachment of middle turbinate and the inferior turbinate. So basically it's an inferiorly placed mass. It is not attached to either lamina papyricia or any posterior part of the either posterior ethmoids or the important structures which are sphenoid and posterior ethmoid basically. So once I ascertain that this mass is not attached to important structures, I can take it out completely. So right now I'm just trying to understand where is the origin of the mass, and once you can see there is some amount of bleeding as well. It happens when you resect the middle turbinate, do the uncinectomy, some amount of bleeding is there. So now I'm entering inside the maxillary sinus. You can see the maxillary sinus, the glimpse of this is maxillary sinus, right? Where my suction is going in, you can see the hollow structure inside. So this mass is attached mostly towards the posterior fontanelle, and some thickening is there around the opening of the maxillary sinus also. You see the mass. This is the mass basically. This one. It is extending to the posterior corona also. So once I know that this mass is, I mean, safe to take out, so I did take a Blakesley forceps and try to remove it. It came out in toto. Now this is the mass. You can see how huge the mass is. It's very big mass, and this man was suffering too much. This is the mass basically. Now we have to see the attachments and debride the attachments so that the chances of recurrence are minimal. What I'm doing right now is widening of the maxillary sinus. This area is a lot thickened, so possibly could be the origin of this mass. Till now, I had no idea that this mass is a polyp or it can be a soft tissue tumor. Definitely, it doesn't look like a malignancy, so we are safe in that aspect. So this is complete widening of the maxillary sinus. I had removed the middle turbinate because when the mass is suspicious, you should have a I mean a clear post-op picture also, and the access should not be limited with the because of the turbinate, especially middle turbinate. The section of middle turbinate, especially the vertical part, does not cause any problem. This is bulla ethmoidalis. So I decided to do one step further in this case, considering I was treating this mass as a benign tumor only and expecting a recurrence in cases of tumors. I was doing one step extra for this patient. So I wanted to do a anterior ethmoidectomy also, which is I'm doing right now. This is the anterior part of the bulla, which I am removing. You can see this part is pretty much clear. No evidence of any mass or any suspicious lesion posterior to the bulla. So I will stop. I will not go more posteriorly because I can see this part is normal. So maxillary sinus, the inside of the maxillary sinus also looks pretty much normal. This will be my limit of dissection. Since this patient also complained of nasal obstruction, uh, I mean, previous to this occurrence of mass, on and off. So since he was in general anesthesia only, so I did a partial turbinoplasty also, so that the nasal patency is properly open, and this person should not have nasal obstruction on the left side after this surgery. So this is the inferior turbinoplasty. I am taking off the polypoidal inferior aspect of the inferior turbinate. Remember, do not resect inferior turbinate completely because it will cause empty nose syndrome. But partial resection and removal of a strip of bone inferiorly does help patient remain nasally patent. So this is the resection of the bone, and it's partial, it's not a complete resection of the bone. So partial resection of inferior turbinate will never cause any empty nose syndrome, but this will keep the nasal cavity open. It's a very effective technique to have the nasal patency. So I told you I did one step extra for this patient just to have a clearance. This part is completely clear. Some amount of ooze is there that will stop on its own. To me, the nasal cavity looks fine. I can see the choana. Some polypoidal thickening is being debrided right now. There is no evidence of any residual or any suspicious looking lesion anywhere. This is again some widening of the mammillary sinus. So this part looks clear to me. See the nasal patency, I can reach directly to the choana with the help of suction. After inferior trabeculoplasty especially, it has made a huge difference. Mass is also completely gone. It will be very important to see the follow-up. So the patient came to me after 6 months when we did the nasal endoscopy. After 6 months, so this is the picture. You can see well healed inferior turbinate. Nasal patency is very well maintained. No evidence of any mass, any tumor. The histopathological examination of this mass was inflammatory polyp. So that inflammatory polyp explains why this polyp was looking like congested or looking more like a mass. It can mimic some tumors. This is nasopharynx. Patient is completely free of the disease. You can see the glimpse of maxillary sinus also, which is open.
मेरा नाम दिलीप कुमार जाना, मैं बंगाल में रहता हूँ, वेस्ट बंगाल। तो मैंने बहुत दिन से, आज कम से कम 6-7 महीने पहले से ही मेरा नाक में काफ़ी दिक्कत हो रहा था, निश्वास लेने में काफ़ी तकलीफ हो रहा था। तो मैंने चेन्नई अपोलो गया था, वहाँ पे डॉक्टर दिखाया। डॉक्टर ने बोला है ऑपरेशन करवाना है, बहुत सारे पैसा लगेगा वहाँ पे, इसलिए वहाँ से वापस आके 15 दिन बाद मैंने दिल्ली चला गया। तो वहाँ पे डॉक्टर विकास कुमार से मिलने के बाद वो मेरा नाक देखा, फिर उन्होंने बोला ये ऑपरेशन करवाना है। तो वहाँ पे थोड़ा सा सस्ता भी हुआ है नाक, तो माइक्रो सर्जरी में मेरा ऑपरेशन हो गया। नाक में कोई निशान नहीं है, अभी ठीक है, सुस्त हो और कोई दिक्कत नहीं है, बिल्कुल फ्रेश हो।